I passed all my tests. I filled out applications because I wanted to seek employment. I passed all my tests until the man called me. It's what the war on drugs looked like to me. Till the man called me and said, Keon, we can't use you. And I said, what happened? He said, why you didn't tell me about your past? I said, what are you talking about? He said, because your CDS charge. He said, come back in 3 years, actually. So what I did after that, I got so mad I joined the gangs. Well, they chose me. I wanted that job so bad, and I just be imagining, like, if they would have hired me, I could have been like a big time supervisor or something now. But they kept bringing up what I did, and I already paid for what I did. I already did my 15 months. I already did my probation. I already paid my fines. Why am I still paying for this 23 years later? And they eat at me because nobody want me. I went through agencies all my life and did the best I can. You keep talking about them 18 bags I got caught with when I was 18 years old. And I'm 41 now with 2 daughters. My eldest daughter, 22 years old, and I'm a grandfather. I got caught with 18 bags. Leave me alone. That's all I got to say.
Good evening, everyone. It's very tough, when before we start this conversation, we have to take into account voices such as that of Keon, who have been locked in a perpetual and never-ending war. Again, welcome to our discussion tonight on decriminalizing drugs, especially here in New Jersey. Thank you for being in attendance. I am Professor Michael B. Mitchell, currently a visiting assistant professor in the Department of African American Studies and Criminology here at the College of New Jersey. We have several panelists tonight, including faculty and students who come from a variety of disciplines and perspectives. So while we will share with you many different aspects of why decriminalizing drugs are important, we hope that you will engage with us in discussion afterwards. Just a disclaimer, the event will be recorded. Also, if you have any questions, please put them in the Q&A box below, and we will make every effort to get to them at the end of our presentations. So in thinking about Keon's experiences being impacted by the war on drugs, it's important to give a brief history of the racist war on drugs. Because by all means, the war on drugs is both racist and classist for its disproportionate impact on not only people of color, but poor people in communities of color. It's also important to note that many of our most vilified drugs today were at one point both legal and utilized for their medicinal properties. Even going back to the 1800s, drugs like cocaine and opium were used to alleviate pain. This was prior to modern medicine. This was prior to our more modern painkillers. So again, drugs like cocaine and opium and various properties were extracted by physicians to alleviate pains and to help those who had physical ailments. Moving later into the 19th century, going into the beginning of the 20th century, various drugs, whether that be cocaine, opium, or marijuana, were often used as political ploys, used to target or connected, to certain racial ethnic groups. And drugs were used, or these different ploys were used to regulate and even criminalize these various racial ethnic groups. So for instance, cocaine was often associated with African Americans. Anti-Asian sentiment was often connected to Chinese immigrants, especially connecting them to the use of opium. Marijuana was often tied to or connected to Mexican immigrants. So various forms of regulation and criminalization of drugs have been tied to race in the United States. So moving later into the 1900s, in the latter half of the 20th century, there was various forms of regulation and criminalization that ensued. So going up until 1971, this was around the time where the war on drugs, as we know it, was at least initiated during the Nixon administration through the Comprehensive Drug Abuse Prevention and Control Act. Now, while it was initiated during the Nixon administration, the war on drugs, as we know it, as we will come to know, was aggressively pursued later in the 80s during the Reagan administration. The Omnibus Anti-Drug Abuse Act, in particular, was the basis for punitive sentencing policies for drug offenders. At face value, it appeared to target, dealers, traffickers, but this impacted many, users, individuals who should have been approached through treatment, should have been approached by, through a public health model rather than a criminal justice or more punitive approach that focused on incarceration and incapacitation and just locking them away. Going beyond the 1980s and up into the 1990s, we saw how policies exacerbated the criminalization of drug users disproportionately, poor drug users of color. So even with the Violent Crime Control and Law Enforcement Act, which was implemented during the Clinton administration, not only did we see, stiffer sentencing schemes and penalties, but we saw more funding poured into prison construction and law enforcement. So we started to see the war on drugs being carried out more aggressively. In her book, The New Jim Crow, Mass Incarceration in the Era of Colorblindness, Michelle Alexander talks about the new Jim Crow, which refers to a reincarnation of racialized social control against African Americans driven by mass incarceration. This was aggressively pursued in the 1980s, often through bipartisanship. And while the war on drugs primarily targeted African Americans, it also affected Hispanics and other racial ethnic groups. The new Jim Crow, as she argues, relegated people of color, especially African Americans, to a caste system for many, which is almost impossible to break, as you heard in the comments from Keon. The war on drugs and the punitive shift in crime control post the 1980s systematically relegated Blacks, especially men, to second-class citizens like their forefathers, where drug convictions, stripped away their right to vote, led to them being discriminated against in the labor market, in housing, and so many other areas. We started to see broken windows policing, public housing restrictions, stop and frisk, zero tolerance policy, policing, and a host of other byproducts of the war on drugs. So I wanted to include some narratives from my own research with system impacted individuals. And I quote, "But how they came about giving me 25 years was they used my past history to enhance and give me 25 years in the feds. I thought it was very harsh, but they're going to get you the best time, the most time, the harshest sentence that they can, especially if you're one of those guys that don't want to cooperate with the government and give up anybody." You know what I'm saying? And then this participant also says, "If you're a stand-up guy, they're going to try to give you the harshest sentence possible. Now, if you're willing to work with them and give somebody up, then you might get a lesser sentence. And most touching is a lot of guys in there, and talking about federal prison, have with life sentences and probably going to die in prison behind just regular crack cocaine. So these narratives from Rick, who served 16 years in the Federal Bureau of Prisons, speak to the harms, the atrocities of the war on drugs, particularly the sentencing disparities between crack and powder cocaine, which were reduced during the Obama administration, but disparities still exist. And as Danielle says, when you're in active addiction, jails, institutions, and death is what comes as a part of that. And Danielle serves several stints in county jail for drug possession. And again, jails, institutions, and death. So when we talk about decriminalizing drugs, we have to keep, we have to have, voices and experiences, lived experiences like Keon and other system impacted individuals that you hear throughout our presentations. You have to hear their voices. You have to feel what they've experienced. You have to take into context the collateral consequences that they suffered because of our punitive criminal justice approach. So why drug decriminalization? It reduces the disruption of families due to incarceration for drug offenses. There's an increasing number of children with incarcerated parents due to the system of mass incarceration that has become a part or came apart from the war on drugs. It creates a climate where people who are using drugs can seek treatment without stigma or fear of arrest. Many individuals who are swept up in the war on drugs have been demonized, have been vilified, but these are individuals who have an addiction problem that should be treated. Racial disparities and over-policing in communities of color, and the severity of collateral consequences, some of which you heard from Keon. So again, the remaining presenters will touch on different aspects that speak to the importance of the decriminalization of drugs. And collectively, we plan to engage with you to come up with better, smarter, more efficient, and more effective ways to treat and deal with those who may have a problem with addiction, those who need assistance and help, and not punishment. Thank you.
We already knew the procedure to grab the fence, not to talk back, not to do any sudden movement because we didn't want to get shot. The first thing that the police officer did was put down my pants. So as he's pulling down my pants, I felt this level of like shame and embarrassment, not anger yet, but, just afraid because I'm only 14 years old. The next thing he does is he pulls down my underwear. And I'm thinking, like, how's he doing this? We in public. Like, why is he doing this? Because I've never been through that before. I never had a cavity search before. And when he didn't find any drugs, he went on to my homeboy. He refused to let him even touch his pants. That didn't stop him from breaking his jaw. So as I pulled my pants up, I felt ashamed because I didn't fight like my friend did. He got his jaw broke almost for our honor because they had declared a war on drugs that ultimately was us. That's the story.
Good evening. I'm Professor Kim Pearson. I'm an associate professor in journalism and professional writing, and I'm here to talk about how media and the media system participate in constructing and legitimizing the war on drugs. And the question I want to pose is, if decriminalization of drugs is such a good idea, and you'll hear very persuasive arguments from my colleagues about why it is such a good idea, why does it seem so radical? And what I want to put to you is that a significant part of the answer has to do with the role of our media. The media shapes our world. We understand the world through cognitive frames. The very wiring in our brain is affected by the images that we get and the metaphors that we get as we learn language. It helps to shape our identity. And often in shaping our identity, media often draw upon ideas about the way the world works and the way we are constituted as a nation that are hegemonic or counter-hegemonic. In other words, ideologies of domination or ideologies of resistance. Media socializes us. It teaches our place in society. Media primes us and to look at other people and communities in particular ways. Media sets the agenda for our public discussions and debates. And I don't know if you noticed the pictures of the two men that I had on that first slide. Okay. One was Hunter Biden, one was DMX. Both men were men who lived with, well, past tense in DMX's case, unfortunately, who lived with substance use disorder, crack addiction. Which one do you think is the face of crack addiction in our popular media? Okay. So I just want to give you a little bit of scholarly framework here. And here I'm pulling from an article by two scholars by the name of Michael Rosino and Matthew Huey. And, you know, that just to contextualize the way that socializing and priming has played out historically in terms of the way media represent drugs. First of all, as Professor Mitchell showed you, drug policy has often been enforced through developed and enforced through a series of moralized racial panics. And as part of an effort to marginalize non-white racial groups, and I'm quoting from this particular article, mass media content is often oriented toward white audiences, and mass media corporations primarily run and owned by whites. Due to the rules and norms set in place by mass media organizations, structures, and relationships and institutions, the institutional practices entail forms of agenda setting so that, in other words, drugs, crime, law, all that discourse is characterized in ways that correspond with dominant racial meanings. Therefore, discourse within the mass mediated debate on the war on drugs does not just describe Blacks and whites as engaging in unequal practices of law abiding, okay, but it labors to naturalize the existence of and the unequal treatment between racialized groups and conceals the racial character of the war on drugs. In other words, it looks as if you're just enforcing policy. It looks as if Black folks are being criminalized in the war on drugs because they're more criminal. That's the way it looks, okay? But that is partially because of the way that our media system is constructed. And I just want to give you some historical examples just to illustrate that. Professor Mitchell mentioned that in the early 20th century, late 19th, early 20th century, when there was a racial moral panic over Chinese immigration, that, you know, seeing Chinese immigrants as part of a yellow peril, seeing them as opium users, and a danger to good white people, you know, gets played out in movies like Just Jim, where the plot is this nice white guy gets shanghaied, that's the expression, by Chinese gangsters who force him into smuggling. Then in 1937, you have this famous movie, Reefer Madness, which is all about nice white people, college students, who try marijuana and start behaving in bestial and animalistic ways. This is simultaneous with the Marijuana Tax Act of 1937, which is you know, at the same time that the popular stereotype of the marijuana smoker is Mexican immigrants. And then, of course, you have the famous case of Billie Holiday, who becomes the target of government surveillance and harassment because she is and singing the civil rights anthem, Strange Fruit. And she did have addictions. And she pleaded in her autobiography for a public health approach to addiction. She said, imagine if the government chased sick people with diabetes, put a tax on insulin, and drove it into the black market, told doctors that they couldn't treat them, then sent them to jail. If we did that, everyone would know we were crazy. Yet we do practically the same thing in every day in the week to sick people hooked on drugs. That wasn't the dominant narrative of the time. The dominant narrative was set by Harry Anslinger, who used drug policy and a moral panic over drugs to help build up his federal agency, which at the time was rather moribund. And what did he say? He said, hey, most of the addicts out here are Negroes, and that causes a problem. In the Nixon administration, when the war on drugs begins, there's a concerted media effort to manage the media discourse to political effect. And John Ehrlichman, who was a key Nixon domestic policy advisor who went to jail over Watergate, gave a revelatory interview in the 1990s. And he said explicitly, you want to know what this was really about? The Nixon campaign in 1968 and the Nixon White House after that had two enemies, the anti-war left and black people. You understand what I'm saying? We knew we couldn't make it illegal to either be against the war or black, but by getting the public to associate the hippies with marijuana and blacks with heroin, then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them right on the evening news. Did we know we were lying about the drugs? Of course we did. If you said that in the 1970s, in the mainstream media, you couldn't get that narrative into the mainstream media in the 1970s. But in the black community, there were subaltern narratives. And if you grew up in New York in the 1980s and the 1990s, you probably watched Gil Noble. And Gil Noble was doing reporting on the FBI's COINTELPRO program. And part of that COINTELPRO program was about, I'm not going to play the video, but part of the COINTELPRO program was indeed about flooding drugs into the black community. Okay. Now, in the 90s, you see attitudes shifting, and what shift and media coverage shifting, and what shifts, an elite consensus. Okay. And part of that had to do, but it was kind of a dual kind of thing, because on the one hand, there's more acceptance for recreational marijuana, but at the same time, you get Bill Clinton saying, yes, I smoked, but I didn't inhale, but I also put my brother in jail for drug use. Okay. So one of the things that'll be interesting is to see how President Biden, who's been very supportive of his son, how that affects his stance in terms of drug policy. Second elite consensus, now that marijuana is a business opportunity, you have Koch Industries on the right, and then you have activists who've been involved for years across the spectrum, pushing marijuana legalization. And now in the cannabis industry is a big beat, okay, in news organizations, which are starving for revenue. But ultimately, if you want to change the narrative on the war on drugs, you have to have diverse voices in and out of the newsroom. You have to have diverse voices in the media industries. In 2018, the New York Times finally published a mea culpa, along with other major media outlets, saying, we were wrong to push the crack baby myth back in the 1980s. And part of what they said was the myth of the crack baby, crafted from equal parts bad science and racist stereotypes, was debunked by the turn of the 2000s. But by then, the discredited notion that cocaine was uniquely and permanently damaging to the unborn had been written into social policies and legal code. Okay. And again, not going to play. And what I find most interesting right now is Andra Day is up for an Oscar for portraying Billie Holiday during that time when she was being persecuted by the FBI. Why is that happening? It's happening because Lee Daniels and other Black creators have gotten to a place in the entertainment industry where they can make those decisions. Andra Day can now be interviewed by mainstream media discussing the disparate treatment of Billie Holiday. If that is tied to a grassroots movement, if that is tied to sustained activism, that may ultimately change the narrative, not only in the media, but in public policy as well. And I will stop there.
Hello, everyone. So my name is Christopher Morera, and I am a junior public health and communication studies major at the college. So in terms of the student perspective, the student's voice adds an invaluable lens to this conversation, particularly because the messaging on decriminalization and the narrative is changing in different fields where students will end up taking these career opportunities or leadership roles, whether this is in the media, in journalism, public health, in different medical fields, in fields pertaining to businesses and social support services. They're all impacted by the way that they view this, as we're getting into a specific time where we're trying to enact some change. So just to start off, I want to say just a little bit of what I thought personally as a student. There is definitely an irreversible damage done to families that have been impacted by it, being a crime and no resources to encompass the trauma experienced in police-heavy areas. Another route to consider, this just being from the student college population, with mental health resources having become somewhat non-transferable during the pandemic, there might be a push for its use toward students. Students have had to cope with economic hardships as well as social barriers. And I think the decriminalization of drugs applies more now than ever to the conversation of COVID-19's mental health toll, as well as the more heavily encompassing narrative of institutionalized racism in higher education. Just being a part of this ecosystem, being a part of this local community, and having experienced anxiety for the first time makes me wonder as a student if the only reason why some of these movements for decriminalization being pushed so quickly is being pushed now as a direct result of some of the crumbling infrastructures we have available for mental health. So I wanted to open up the conversation to some of my peers, and I was able to gather within a survey of 24 students some of that information. So some of the student opinions that were most notably seen. The first point that I raised, and the first point that a lot of students brought up, is that there is not much understood about how decriminalization can impact mental health, not just on campus, but in other communities as well. So it's important that we are educated on its effects. Some people felt, these are some of the comments raised, some students felt that that was the movement would push for self-medication, while they felt it might be less dangerous than alcohol. Some students have seen from the media that there is a huge impact on how students' mental health and heavy drug use can be a result of trauma and damaging one's own mental health, mental state. These are just, again, some points raised. Some students felt that that some people do not need drugs to feel good about themselves. They just need the support system. And that's where we talk a little bit more about how that crumbling mental health infrastructures are now being pushed to either reform or renovate. And that's why when touching upon the funding of the justice system, where some reform can be, where some of that reform conversation comes in, because there needs to be more support system for the communities that have been impacted the most. A student raised an example of weed as an example, which they felt can be beneficial for certain individuals and reduce stress. However, some can face adverse effects and growing independency. The graph that you see at the bottom, the chart that you see at the bottom, is to talk a little bit about how advocates feel on drug legalization, because making high quality drugs cheaply and widely available will eliminate some of that illegal drug markets regularly. And this is just a conversation that pertains to a decrease in law enforcement costs, including arrest and incarceration. So as you can see, 24 out of 24 students, 45% thought that addressing the concerns and impact of mental health are important. Well, to address point 3, the knowledge of drug decriminalization developing relevance in personal career aspirations. We will get back to point 2. I believe there was a little issue, but out of the 24 students, 59% think that addressing drugs and their impact on higher education are also important. They're not fully aware of how that impact of drugs and higher education correlate, but there are some people in higher education that want to see a better understanding of how, as a shelter community, we can surpass our ideas of what's currently happening in our local communities to make up for that knowledge that we're not quite sure about, because during this time, it is a pressing conversation that we're having with the media as well as policy and legislators. Back to the point where I was talking a little bit more about the local community. It's not just a campus, but it's a part of a larger surrounding area. So we can students were challenged to think about, in terms of TCNJ being a microcosm, how does what we know about the decriminalization of drugs, how will it impact local communities? If some drugs are used highly on college campuses, addressing it at TCNJ will extend the impact of neighboring communities like a domino effect. So some students feel as though it'd be better to, address the issue, provide more education and more safe spaces to talk more about this, so that they are well aware of what situations may happen in other communities and the communities that are impacted. So those are just some 3 points, and hope you guys understood a little bit more about, the student perspective and what they feel can be more expanded on and elaborated on with this conversation.
My son was arrested for the first time at 18 for his first possession charge, and that was the first of about 4 possession charges throughout the last 10 years. He's now 29, still in the criminal justice system, still unable to leave the state. He had, after the possession charge, he was put on probation and he was given treatment he had to go to, and he actually has gone to treatment about 20 times through the criminal justice system, trying to get him to comply, trying to get him in recovery. Abstinence was what they were looking for. Once he got into the criminal justice system, it changed everything. It changed how he felt about himself. It changed how he got along with the family. We've never had anybody who was involved in criminal justice before in any of our family. After being in the criminal justice system for so long, we started seeing a real change, and there was a lot of depression. And through that depression, he had seemed to overdose a lot. One particular time that he had overdosed, we called 911 and he was taken to the hospital, and he was in a court program, well, for 10 years, so he never really got out of them. He was in a court program and he overdosed. I called 911, he went to the hospital, and I followed them to the hospital. When he regained consciousness, I walked into the room and he looked at me, he opened his eyes and he said to me, "Why, you should have let me go. Like, why couldn't you just let me go?" And, some will tell me that he didn't feel that way. That was just a drug speaking, but that's not the first time he's told me that. He's so hopeless. And 20 minutes later, the sheriff's department came in and said it was a violation, that he overdosed, and he was arrested and spent the next 6 weeks in jail, where I fought for him to go back to treatment instead of sitting in jail. He was a commercial fisherman. He can't do his job. That's a risky business for them. Even though there are boats that he could get onto, they won't let him go because he's in a program. So he just feels like everything that he's ever wanted, everything that he ever dreamed of, he's held back. Never to be able to leave the state, 11 years of not leaving the state, not being able to go to vacations, missing his grandmother's funeral. There were so many things that happened. And every day I see him sinking deeper into this depression, which I just don't think, I think that if he hadn't been involved in criminal justice and we got him a great lawyer and he got out of the system before he even got in, I think we would have had a whole different life for him.
Good evening. I am Dr. Natasha Patterson, public health professor here at TCNJ, and I'm going to focus on the health policy aspect and in the war on drugs. And I wanted to first start with the ecological perspective is what we tend to use in public health in understanding the connectedness that we all have with one another and the connectedness between our fields. So when we think about the ecological perspective, the individual and the community are considered simultaneously. Harmony between us and our environment, and when there is disease or illness means there is disharmony. This perspective takes into consideration that sometimes there is no single factor that can impact health and behavior change, but there are many factors. So not sure who's in the room, but I want to kind of level everything out and provide some basic information about public health if you don't know. Public health focuses on populations and community health. That differs from clinical medicine, where there's one-on-one care with a patient. Our patient is the community. Our patient is different groups, different populations. And we focus on prevention. We focus on preventing disease and promoting health. We have three core functions in public health: assessment, policy development, and assurance. And today I'm going to focus on the policy development aspect, which is the use of scientific knowledge to develop a strategic approach to improving the community's health. And if you see the little word design here, you'll see all aspects of what goes into public health. So there's all these different, we cover so much, and public health is so broad. So I wanted to first lead with the organizations that are very significant in our field of public health is the American Public Health Association and the Center for Disease Control and Prevention. So APHA put out a statement around structural racism and systemic racism. Racism structures opportunity and assigns value based on how a person looks. The result, conditions that unfairly advantage some and unfairly disadvantage others. Racism hurts the health of our nation by preventing some people the opportunity to attain their highest level of health. Racism may be intentional or unintentional. It operates at various levels in society. Racism is a driving force of social determinants of health like housing, education, and employment, and is a barrier to health equity. And most recently, if you've seen some of the headlines, the CDC put out an official statement declaring racism a serious public health threat. To build a healthier America for all, we must confront the systems and policies that have resulted in the generational injustice that has given rise to racial and ethnic health inequities. We at CDC want to lead in this effort, both in the work we do on behalf of the nation's health and the work we do internally as an organization. Those are significant statements from two very significant organizations in our field. And the driving force behind those statements, there will be a number of initiatives put in place so that we can address some of these issues. And leading into this information about the social determinants of health. So social determinants of health are the conditions in which we live, in which we work, in which we play, where we worship, all of those conditions that impact our health. So they may not look like health issues on the surface, but when we dig deep and we look at how they are, how our lives have played out, it definitely leads to how we make decisions about our health and what opportunities we have in front of us. So policies based in exclusion and oppression that create structural barriers, systems based in racism do not need to have those who work in that system to be racist for it to be harmful. A system is built to create the same outcome over and over again. So we're talking about systems, not individuals. We're talking about system structures that are impacting how we live. These policies impact our socio-economic system, which includes our education, our housing, our employment, our health, our community, and the criminal justice system. And then these outcomes lead to how they impact our social determinants of health. And if you look in both of these categories, how the policies impact us and what we consider for our social determinants of health are very similar. So you see education on both of these, in both of these categories. You see housing and employment in both of these categories. So when you look at how these policies impact us, they definitely impact our health as well. So when we look at the war on drugs, just the phrase of it, the concept of war on drugs, how do we declare war on an object? What are the casualties of this war? This war impacts families, generations, communities. Could you ever see us declaring war on heart disease or declaring war on cancer? 50 years ago, as it was stated before by my colleague, in June 1971, Richard Nixon declared drugs the #1 enemy. And then it led to all these practices: no-knock warrants, arrests, convictions, mandatory sentencing, increase in prison population, children being removed from their parents' custody, ban on funding for syringe exchange programs, the crack house statute, and DARE programs being implemented in schools everywhere. This created an impact in our community. It created a cycle of trauma, mental health, generational damage, community damage. And actually, the purpose that was stated, while there may have been other reasons, the purpose that was stated was that they wanted to address the drug problem. Well, drug overdose and ER visits associated with illicit drug use actually increased. Marginalizing and stigmatizing drug use leads to worse health outcomes, including the risks associated with transmitting diseases like HIV and hepatitis C. Incarcerated 1.3 million people. A lot of this was for possession of marijuana. Black people almost 4 times more likely to be arrested. And then the differences in sentencing, which already mentioned earlier, between powder cocaine and crack users. Health was not a priority and was not even considered in these policies. So when we look at public health as a framework and how we address public health problems and issues, the framework includes a community assessment. We want to first know what the problem is. We want to know what the root of the problem is. We want to know what the symptoms are. We want to know what are we addressing. And we go through this whole process, and included in that process is scientific literature. We want evidence-based practice. We want to make sure that we are doing what the science says, what the research says. And then that towards the end, we're evaluating, because we don't want to just put programs and initiatives and policies out there and not ever look back. We want to look and we want to assess and we want to see, are we doing exactly what we intended to do? You know, what are the intended consequences? What are the unintended consequences? And we want to be able to have room to revise and make change. Harm reduction. Harm reduction model is something that overlaps with a lot of public health frameworks, especially our prevention model, which is 3-tiered. So we have primary, secondary, and tertiary prevention. Primary is preventing the initial use overall. Secondary is to address the problem after it has begun. And tertiary is to prevent advanced disease or death. So when we look at that, and then we look at harm reduction, there's an overlap there in how we handle, addiction and recovery. And we also want to understand that harm reduction is grounded in justice and human rights. So it's a whole different, framework. It focuses on positive change and working with people without judgment, without coercion, without discrimination. And there's no stipulation that says you have to stop using drugs at this very moment in order for you to get help. And for those who are unaware that harm reduction is used in other areas, we use harm reduction with sunscreen, with seat belts, with cigarette filters, with birth control. We use the harm reduction model in many different ways in public health. And just some quick policy updates and development. I wanted to highlight some of, and I'm sure my colleagues will share a little bit more about these, but this is already being done. Oregon is the first state to decriminalize all drugs. Maine is also looking at personal use and as a civil matter as opposed to a criminal matter. Maryland, and then Washington State. And all of them have the similar language around getting people into care as opposed to putting them in prison. We want to consider, like I said before, the intended and unintended consequences of policy when we are developing policy or revising policy. We want to consider health, human rights, and justice in development of these policies. We should always look at the evidence and make sure our decisions are evidence-based, and we want to consider all stakeholders. And there must be ongoing evaluation to be included to ensure that the purpose being carried out is providing opportunities for revision, and we want to collaborate. We do not exist in a silo. We should not do this work in a silo. Just like we have everybody on this panel from different fields, and there's even more involved in this work, I think we should continue to collaborate and work together to address some of these issues. And this is ideal, I know, but that's what we're trying to work towards. And these are my references, and I'm looking forward to having a great conversation with my colleagues this evening. Thank you.
Hi, I'm Michelle Naples, and I'm going to be talking about the cost of the drug war, the economic side, and the kinds of resources we can release if we shift an orientation to public health instead of punishment. Oops, sorry, I'm going too fast. We're told that this is a war on drugs, but the initiative has never succeeded in reducing drug use. And so when a policy fails, normally we would try something different. If you look at, for instance, overdose deaths, the most extreme consequence, and compare drug overdose deaths to things like deaths from homicide in New Jersey, deaths from firearms, it swamps them, okay? We are at 3 times the national rate for heroin overdoses. And since 2004, there have been 14,000 deaths from just this, from overdose. So with this attention to the opiate addiction and problems with overdose, we see the deaths from drug overdose have really skyrocketed. You'd think if this were a war on drugs that we would see skyrocketing arrests associated with use of opiates. But what we see the increase is marijuana arrests. And in fact, opiates, cocaine are down here pretty flat over the periods in the last 10 years. People in New Jersey are 3 times as likely to die from overdoses from a gun or any other homicide. So, okay, if we move to a public health approach, then what that means, decriminalizing, would mean that you get a ticket. It's like a car, a driving infraction, rather than that you get kind of really punished and beat up and constrained for the next umpteen years of your life. It turns out about 1/3 of the people in New Jersey have in their lifetime used illegal drugs, but only something less than 5% would be considered drug dependent or addicted, and really only 1.5% are addicted. And yet these are the people who are most driven by drugs and have most dysfunctional patterns of behavior. Let's help them. If we want to fight drug addiction, let's fight drug addiction and help them heal. New Jersey estimates that we have about 450,000 people with an illegal drug disorder, but only about 13.7% of them actually get treatment for the disorder. So I want to talk about 4 axes of the expenses that go into fighting the drug war. And 3 are direct expenses for police, incarceration, and judiciary. And the 4th is the casualties, kind of the health expenses associated with casualties of the drug war. So to remind you, as I speak about these things, it's not one public pot. We have the state police, for instance, and then we have local police in 565 municipalities in New Jersey. We have county jails, 19 county jails in 21 counties. There are also 2 federal prisons, and we're not talking about changing federal law right now. We're just talking about state law. And there are 14 state prisons, 2 youth facilities, some halfway houses, a medical unit. The judiciary encompasses criminal courts and drug courts, lawyers and legal aid, and a big system for probation and parole, which was alluded to by one of the testimonies. And when I talk about casualties, I'm talking about not just death from overdose, but emergency room visits, hospitalization, intensive care. Okay. If we look at employment, I'm an economist. Let's look at the employment of police officers and of officers in jails and prison. There's been a move in New Jersey over the last 10 years to try to do something to downsize some of this, for reasons I won't go into. But there's always already a recognition that this is a dysfunctional system. And so there was some drop in the total number of police officers since 2010, but it's bouncing back up again. And if you look at the last 10 years of officers in jails and prison, it's pretty flat. So there's tremendous institutional inertia. I'm going to talk about the resources that can be released, but there's going to have to be new rules of the game written, new institutional frameworks put in place in order to effectively transition to a different way of handling this problem and stopping what's been really a painful impact on the Black and brown communities. Before the 2017 Act, which changed the way we handle bail in New Jersey, we had a situation in jails where 2/3 of the people there were just waiting trial. Many of them couldn't post $2,500 bail. And you can see that the state prison population exceeds the county population. Okay. That bail reform led to a 44% drop in the pretrial jail population. But when we think about the carceral system, it's not just jail. It's not just prison. This is from Prison Policy Initiative for New Jersey. And about 1/4 of the people currently supervised, currently subject to probation, parole, prison, and so forth, 1/4 are in prison or jail, 3/4 are in parole probation. To the extent that if we look at the total population of New Jersey, this is 2.2% of the total population, or 3.5% if we exclude those under 18 and over 65, which is extreme. And if we think about the health consequences, the untreated health consequences, and how that plays out, I have a graphic on drug-related hospital visits in the state. These are total expenses, private and public, for overdose care, which would include emergency room visits, admission, intensive care. For hepatitis C, I think Natasha mentioned this, IV drug use. When you're not allowed to share needles, when you're not able to get clean needles, then people share, and it can pass hepatitis C to each other. And the consequences of, problems, neonatal problems, if the parent is a drug user, this is not a permanent condition. You can heal from it, but it's expensive. It takes resources on neonatal ICU. Here's the hope. In Portugal, they now, after 10 years with decriminalization, maybe more, they have 51 overdose deaths a year in a population of 2.28 million people. In New Jersey, this most recent data, we had 2168 drug overdose deaths in a smaller population. Imagine if we could just get rid of that problem, attenuate it. Other aspects, kind of overflows or externalities from drug use include other kinds of infractions. It turns out when we measure total arrests associated with the drug laws, if we want to include people who are engaged in burglary or larceny or auto theft or stealing property because they're financing a drug habit, we need 30% more in our numbers. Just the drug arrest is an understatement. So I pulled together, this is preliminary, please don't hang your hat on this, but I pulled together some numbers using Jeffrey Myron at the Cato Institute in 2018, came up with some gross figures, which include the whole cost of the drug wear. This is prosecuting people who are selling or manufacturing drugs, as well as people who are using drugs. If we decriminalize drugs, we will only save on the demand side. We're not talking about legalizing at this point in New Jersey. I'm not talking about legalizing. We're talking about reducing the punitive approach to people who use drugs. And so if we focus on, I have underlying statistics, I'm happy to share the resources that I used. If we focus on possession of drugs and the how many resources will be liberated, we would save $300.6 million on police judiciary incarceration, minus $21.3 million because you'll still have some police around giving tickets. I figure we'll need 15% as many police involved in giving tickets as we needed to find people, arrest them, take them back to the station, book them, and so I want to expand the numbers to include these other drug-linked crimes that don't get reported as drug crimes because it's the FBI practice that's used in New Jersey. The highest thing you're charged with, that's what gets reported, the highest crime or most serious crime. And then, sorry. We know that 27% of those convicted for drug sales were doing it to finance a habit. So if we can just deal with the fundamental underlying problem of addiction, we could save another $47.4 million. In terms of the health consequences, I focused on the public monies. This is the total expenditure on these problems. I think it's 53% is public money coming through Medicare, Medicaid, and New Jersey state financing that contributes to serving the indigent in the hospitals. For overdose, for hepatitis C, for infants who need a special care. So the potential savings approaches $500 million annually if we move to decriminalizing. Thank you.
Hello, everyone. I'm Sandy Gibson, and I am a professor in the Department of Counselor Education at the College of New Jersey. I want to talk to you a bit about the process of moving forward with proposing decriminalization of drugs in the state of New Jersey. And I do want to do just a quick clarification of the difference between legalization and decriminalization. With legalization, that would be along the lines of being able to go and buy any type of drug that is now illicit, like cocaine or heroin, in a store. That's not what we're talking about here. We're talking about the decriminalization of drugs so that individuals who use drugs receive public health benefits, social support in regards to that to help them deal with their drug use rather than incarceration, separation from families, and decimation of communities, which is what our current criminal justice approach provides for us right now. So I want to talk to you about what this pathway looks like for us to move forward and move into decriminalization in New Jersey. A little bit of the history of how we've gotten to the point in this country where we're receptive to the idea of decrim. The first thing was LEAD, Law Enforcement Assisted Diversion. And through LEAD, this is a program that really started in Seattle in about 2011. And it essentially gives police officers discretion to not arrest and to book someone for drug offenses, but instead connect them with the case manager who gives them linkages to support services. So essentially, it's kind of an off-the-books decrim. It's not legislation. Different townships or cities bring forward LEAD. We actually have a few communities in the state of New Jersey who have LEAD programs as well. But you'll notice the key term here gives officers the discretion, which means they can, but they also cannot. So it's a choice of who they choose to interact with this LEAD engagement with. It's still kind of officer option, so to speak. But that led us into the idea of declining to prosecute, which again, this is really led by prosecutors in different cities and towns. Baltimore is doing it right now during COVID for most personal use drug charges. The prosecutor in Philadelphia has done a decline to prosecute for all marijuana charges. And there's actually been arguments with the police department over that because police are continuing to arrest and the prosecutor is refusing to prosecute, but the police aren't stopping. So it's not going to be the most consistent and best way to deal with this problem in our society. But again, it's a step forward with people publicly acknowledging that this is a problem. We have our 911 Good Samaritan laws where if you call a police officer, an ambulance, because someone's having an overdose, and you stay with them to keep them safe while you wait for that ambulance to come, when the police and ambulance come, because they do always come together, you will not be prosecuted, even if there is drug paraphernalia with you, if there's active drugs laying out and they see it, you still won't get a charge, you won't get arrested, because you have a protection under this legislation, which is wonderful. But as you heard the story of the woman who shared a story about her son, she took him to the hospital because he overdosed. He went in an ambulance, she followed him. At the hospital, the probation and parole officer found out that he overdosed, which meant that he used drugs. And if you use drugs when you're on probation and parole, they will consider that a violation of your probation and parole and throw you back in jail. This young man has been trying to get off probation and parole for 9 years, but he's continued to be under the thumb of the criminal justice system, and it continues to give him penalty after penalty. So the 911 Samaritan law is good. It's very good. It saves lots of lives, but it still doesn't protect everyone in all situations. Then we move into our legalization of cannabis, which we just did via ballot initiative in November, which was fantastic. It was a big battle with this one. There was a lot of community misinformation. There was a lot of media misinformation, not just about this initiative itself, but historically about marijuana and what some people propose as being the dangers of marijuana. But the legalization of marijuana actually makes it a lot safer for individuals in the community, which is wonderful. So that legalization piece is important. There's now 17 states in this country that have a legalization of cannabis. If you look at this chart I have here, this is New Jersey, and it shows you the arrests for drug charges, primarily cannabis charges, in the state of New Jersey. And in Mercer County specifically, and this graph is about Mercer County, Black people are arrested 4 times more often than white people for possession of cannabis. 4 times more often. However, Black people actually use marijuana less than white people. And there's a lot fewer Black people living in Mercer County. If you look, there's almost 235,000 white people and 80,000 Black people. And yet somehow 4 times more people 4 times more Black people in Mercer County are arrested than white people for this offense. Now, if we take this information and move it up to Hunterdon County, which is just our next door neighbor, Black people are almost 14 times more likely to be arrested for possession of cannabis than white people. 114,000 white people there, only 3,600 Black people, and yet they are almost 14 times more likely to be arrested for their use, even though they use less often. So our legalization of cannabis in terms of a social justice approach to drug policy is critical when we look at the racial discrepancies with how we enforce these drug laws here in New Jersey, here in our very local community. Now, moving on to Measure 100 in Oregon. This is where they actually put a ballot initiative, and they got signatures to put this on the ballot to fully decriminalize drugs in Oregon. And that's wonderful. They can do that in Oregon. We can't do that in New Jersey. We have to get our legislature to agree to allow us to have a ballot initiative. We can't just get signatures and put our own ballot initiative up, which is unfortunate because I'd love to be able to do that. But we're still moving forward with addressing the legislature and trying to move forward with getting them to put this as a ballot initiative in New Jersey. So some people might think that Oregon is a one-off. It's not. Some of my previous presenters shared some of these. Washington State, Maine, Maryland, Vermont, Massachusetts, all 5 of them have current pending legislation to fully decriminalize drugs in those states. So we would be the 7th state to put forward legislation. I would like to be the 2nd to actually move forward with it. But we are not alone in this initiative, and it's a very important step to take to deal with the necessary decriminalization of drugs in our country. These are just a list of the other states that have very recently legalized marijuana. All right, so in Oregon, what did they do? They essentially made the possession of small amounts of any kind of drug a simple violation. It's like getting a traffic ticket. You will not go to jail for it. And they've also exceptionally increased the amount of funds available for people to receive services. These funds come from many of the cost savings that Dr. Naples just shared with you. In addition, they're using the marijuana sales tax to help fund them as well. There is a fine. So this sort of ticket or penalty that you get for a possession of a personal quantity use. Remember, we're not talking about distribution. Distribution would remain a crime for incarceration. This is about personal quantity use, having that on an individual being decriminalized. And if you can't afford to pay that fine, you can actually have your fine waived if you complete a health assessment, where as a result of that assessment, they identify any resources you might need and they offer them to you, but they're not compulsory. They're not mandated like they are right now with the criminal justice system. So it's your choice. This is the actual language that they put forward on the Oregon Measure 110. So you can see what people were actually voting on, the direct language, and there was clear support for it. So 58%, almost 59% of people in Oregon supported the decriminalization of drugs. It takes a massive community education effort for people to understand the racist history of our drug policy, the racist current operational practices of our drug policy, and the need to do something different to save our communities. So this Measure 110 in Oregon created something called the Drug Treatment and Recovery Services Fund. So their marijuana taxes make them in excess of about $145 million a year. So big money in that. We in New Jersey anticipate about $80 million in marijuana tax revenue annually. And the reason we anticipate having less, even though we have a really robust population, is New Jersey intentionally created a very low tax on marijuana. It's 7% in New Jersey, or it's going to be, but it's 17% in Oregon. The reason we have an intentionally low tax is there's a concern if we tax it high and it makes cannabis expensive, then it's going to drive people down to an illegal market that's more affordable. So in order to make sure that what's being offered that we know is pure and not cut and safe to use in stores and that it's something that people can afford to do. If it's cheaper to buy in the street, they'll continue to buy it in the street and maintain that illegal market. So the anticipation of trying to do that, we've had a much lower tax rate associated with it of 7%. There'll be law enforcement cost savings with decriminalization as well. And they can also redirect their time and resources to other crimes that are in much greater need of having their services. And it also really increases access to care. It offers treatment, trauma-informed treatment, evidence-based treatment, culturally competent treatment. Often these are things that are not available in the community. It gives peer support and recovery services. It offers transitional, supportive, and permanent housing, as well as some of the harm reduction services that Dr. Patterson referred to in her presentation. So it's not just, we're going to give you this ticket, you pay the fine, have a nice day. But they recognize that this is a public health issue. And if you are someone who needs services, if your drug use is problematic, we have services for you to help you address that don't involve throwing you in jail, separating you from your family, causing you to lose your job, and destroying your relationships. But instead, we can provide services and resources to strengthen and support all of those things, to keep you a contributing member of the society. Something a lot of people don't know is that most people who use drugs aren't addicted to the drugs they use. They use them recreationally. But we treat anyone who has a possession charge as a criminal, and we upend their lives through the criminal justice approach and incarceration when these individuals are using recreationally. And the only problem with their life right now is the involvement of the criminal justice system. So if you look at the budget here, this is the budget in Oregon as a result of the decriminalization policy. And you can see the vast increase in resources for drug treatment and recovery services from 61 million to 182 million. State school funds for evidence-based prevention services, not DARE, which has no evidence base whatsoever, but instead teaches kids to fear the police. This moves from 17 million to 73 million. So all of these resources, vast increases as a result of this decriminalization policy, strengthening individuals, strengthening families, strengthening communities. And people are afraid, right? There are a lot of people who are doing some fear mongering and trying to create anxiety and catastrophizing what's going to happen to this community. But we already have a really good idea of what's going to happen in Oregon because Portugal did this in 2001. It's been 19 years since they decriminalized all drugs. You can look at this chart here and it shows a gradated decrease, and it's ages 15 to 24 on the left-hand side. So those are the people most individuals are concerned with starting to use drugs with the decriminalization process. You can see a decrease in actual drug use from 2001 to 2007 to 2016. So it's just going straight down. It has not caused an increase in drug use. There was a huge fight in Parliament in Portugal when they proposed this initially in 2001. It is a very conservative, very Catholic country, massive opposition to this. But once it happened and they saw the outcomes, there is universal acceptance and embracing of this policy. Nobody wants to go back to the old way. Of the people who get referred for the assessments in Portugal, they identify 90% of them are just using recreationally. It's not a problem, and they're sent on their way. 10% are identified as having problems with their use, and they're offered services, but again, not forced into it. But everybody is offered prioritized access to treatment and any kind of other support service they need, like employment and housing, much as what they're offering in Oregon. And all of this resulted in a 60% increase on people seeking treatment. Seeking treatment is no longer scary because you're not fearing the involvement of the criminal justice system in your life as a result of disclosing your drug use. So now it's safe to go and say, I use drugs and I need help, and I'm not afraid I'll be thrown in jail. I'm not afraid my children will be taken from me. In New Jersey, this is a survey that was done by Lake Research Partners and HIT Strategies, and it was designed with a random digit dial survey that was done online, reaching out to people throughout the state of New Jersey, looking to see what was important to them in regards to drug use and drug policy change. And there's a clear identification in New Jersey, people 71% viewing overdose as being a significant problem. And the details of that were shared by Dr. Naples a few moments ago. So we know in New Jersey, we have a significant problem with overdose. We know in Portugal, again, she reflected some of these numbers as well. In the United States, 185 overdoses per million versus Portugal, 6. It wasn't always that way. If you look over here in 1999, pre-decrim, they had 369 deaths. In 2016, down to 30. HIV diagnosis from 907 to 18. So we see very clear positive public health consequences to the decriminalization of drugs. When you ask people, this is a survey of people who were involved in the Portugal system. They got the quote unquote ticket for drug possession there. And the purpose of the commission that works with them and provides them with services, they see it as to help them quit, to inform them of problems, to help them change, to inform them about the law, to refer them to services. And only at the very bottom of this list, the last one, very few people actually saw the system as being intended as punishment. Right now in our society, we have a very puritanical punishment, criminal justice approach to people who use drugs. Decriminalization takes that away and allows us to transition to prioritizing people's public health. Now, the World Health Organization fully embraces this. The World Health Organization, as well as the Global Health Initiative from the UN, they both say publicly, full support for decriminalization of personal drug use. They say all countries should work towards this. And reduce incarceration, and they should also ban compulsory treatment, essentially forcing people to go into treatment who use drugs, especially because many treatment programs aren't doing evidence-based work, and many criminal justice systems forbid people who are on probation and parole from engaging in this evidence-based programs such as methadone. So why do I advocate for the decriminalization of drugs? It is the single most arrested offense in the United States. So think about the resources we could have to prevent and to support and to repair if we took our money away from separation and incarceration. It is the consequences of arrest are severe, separating families, racial disparities, over-policing in communities of color. It frees up law enforcement resources to be used in more appropriate ways. It will significantly lower our very high overdose rates. There is a significant lack of investment in treatment and harm reduction infrastructure in this country. And if we could use the financial resources that would be freed up that Dr. Naples talked about and move them into investing in treatment and harm reduction infrastructure, that also will contribute to lowering the overdose rates. We will prioritize the health and safety. We will prioritize humanity over punishment for people who use drugs, and reduce the stigma associated with drug use so that people who use drugs are more likely to get help instead of fear that stigma. It will reduce the number of people who are involved in the criminal justice system. Think of that woman's son, who for 10 years has been trying to get out of the criminal justice system. She is convinced that it is the criminal justice system that exacerbates his continued drug use, the trauma of being involved in this system. It will improve the cost effectiveness of our very limited resources and improve treatment outcomes where treatment is called for and desired by the people who are seeking it, and remove barriers for us implementing evidence-based practices like being able to offer methadone treatment to people who need it. I'm going to share with you now, as a part of that research that we did with people in New Jersey, we actually did this with several different states. And you're going to see a graph, and it's going to share a story that was read with people who were in a large focus group with us. And they had a dial that they held in their hands where they turned the dial up as they agreed and down as they did not agree with the story that was shared with them. So I'm going to share with you a story where we imagine a world where we make this transition, and we can look at the line for New Jersey. It's the green line in this chart, and help us understand what this world could be like if we move towards decriminalization.
Imagine a world where we have what we need to overcome our challenges, where we can get and stay well. The truth is, life is hard. We all struggle with something, and for many, this includes addiction. Imagine a world where we treat each other with care, a world where people aren't locked away for our mistakes, but offered a way to heal, where rehab and treatment are widely available, helping people overcome these challenges. When we join together, we can make this a place where we have the support that we need to recover from addiction and shape our lives into what we imagine they can be.
Thanks, Sandy, for your final presentation. I'm going to ask you one live question before we go to the whole panel that related to your presentation particularly. There's a question about in your data about the arrests by county.
Yes.
So it says it's approximately 14% of the arrests in Hunterdon County of Black people versus white people. How is it calculated? Is it calculated by the arrest happening within the county, or is it calculated by each individual person's place of residence?
By the arrest happening within the county.
Great. If that didn't answer your question, feel free to jump in and ask us a follow-up. So I'm going to pose a couple more questions to the whole group. I'm going to add the panelists back up here. And while we're doing that, feel free to drop in any additional questions you have as well. Can you share your thoughts on how legalization of the current drug market could materially change school, housing, and economic status of poor BIPOC communities?
Go for it, Michelle.
Well, just if you're convicted of a felony, which possession of a certain amount of drugs would qualify, then you don't have the right to government funding for college. You don't have the right for public housing. If you have poor family that need public housing, you have to be separated from them or they can't get access. So this would all change.
You know, and really following up with Michelle, and again, I think many of us spoke about it in our presentations, you know, the collateral consequences of having a criminal record, of having a drug conviction. So like Michelle was saying, public housing restrictions, barriers to employment, you know, these are things that if we were to decriminalize drugs, it would significantly change this, but also, you know, investing, so taking the money, taking these monies and investing back into these affected communities, right. Communities, especially, communities predominantly Black, Hispanic communities, and other people of color who have been disproportionately impacted. So taking these funds and investing in education, investing in critical infrastructure in these communities would be a far more, this would be a better approach than our criminal justice approach.
And just to add to that, when you mention the barriers to employment, if you know how many of us in this country, our employment is attached to our healthcare, most of us have healthcare because we have a job. So when you think about that, that is a huge change that would happen. Is having access to employment also gives you access to healthcare and full-time employment that could potentially provide you with healthcare benefits. So that alone would be a huge shift as well.
Well, in many states also, we're talking about voting rights.
Mm-hmm.
There are still states with felony disenfranchisement laws.
Even in Florida, Kim, where they recently, in the last election, right before the last election, they actually passed a law that said that you could know once you've served your time, you can vote again. Mm-hmm. And so then the governor quick made another law that said, yes, but you have to pay all your court fines first to make sure that those people lost their, so the legislature gave them the right to vote, and then it was quickly snatched away.
Mm-hmm. And that's a strategy that continues, is fines, and how fines are used to be kind of a gatekeeper to freedoms and opportunity.
Yeah, I didn't even talk about that, talking about probation and parole and so forth. It's expected that you're going to be paying money all the way through all that.
Mm-hmm.
I mean, even when you're in jail, when you're in prison, if you work, you get paid a tiny amount of money because you're supposed to be paying your own room and board in prison.
Mm-hmm.
Well, one of the things that has happened in the structured media industry is local news and many national news organizations have lost about half of their employees, editorial employees, since 2008. But what has happened in their place is the rise of a number of independent investigative reporting outlets, such as Reveal, such as ProPublica. And there you can find really good coverage of some of these issues. Now, their reach isn't, the media market's very fragmented. And so the people who are getting that information isn't nearly the way it was back in the days when everybody had 3 networks and, 2 local newspapers that they paid attention to. And so while we're having this conversation, there are these parallel media universes where people are hearing very different messages. The recapitulation of this, scary messages that I talked about in my presentation.
Great. So our next question, what can we do as individuals within our community to work towards decriminalization of drugs in New Jersey?
Well, that's a great question. There's actually an organization called Abolish the Drug War New Jersey that is working right now to draft the legislation they're going to put forward. They're seeking legislative support for that right now, and there's a lot of activity going on within that coalition. Britt is going to post a link in the chat that has a Google form where you can sign up to start receiving information from this coalition on how you can get involved.
Great. The next one's a additional follow-up there. The panel noted misinformation. How do we raise consciousness around decriminalization with the populations that these issues affect most?
Misinformation is a huge problem in many fronts. And there's a lot of research going on about how to do that. One of the things is that journalists are learning to change the way we write stories. Whereas before, if some public figure or somebody said something that was demonstrably untrue, we would report so-and-so said X, and then say, oh, here, but the evidence doesn't support X. Now we've learned something called the truth sandwich, which is to say, here's the evidence, on such and such prominent individual said this. Here's why that's wrong. Here's why that's not consistent with the evidence. So that's on one level. On another level it's really important that people, if they're armed with information like this, that they engage their peers. What we've learned is that people, it isn't just about the facts, it's whether or not you trust the person or the outlet that's giving you the facts. And so it's very important that credible evidence-based information be widely disseminated among people who can have conversations with their peers.
Okay, so we have 3 more here left, and we're just about at time. So if we can answer these last couple quickly, that would be wonderful. So the first is more of a comment, but if you could share your thoughts on it. One person shared and said, I have an issue with blanket decriminalization and legalization of all substances, as some substances have different psychoactive effects.
Well, that's true. They do have different psychoactive effects. So we're not encouraging people to use drugs or saying that using drugs is safe. What we're encouraging is that, and we're not encouraging legalization of drugs either. We're encouraging that if people do use drugs, that they have, first of all, harm reduction services to make sure they do not die of an overdose, because we believe in the humanity of everyone. And that they have the support services they need, that if their use becomes problematic, that they can receive the support that they need to stay with their families, keep their jobs, be healthy, functional, contributing members of the society, rather than locking them away and throwing away the key. I often think if you have a family member who uses drugs, what would you want for them? What would you want for your child? What would you want for your brother if they ended up using drugs? Would you want them in a jail cell, or would you want them to receive support services and treatment and interventions so that they could stay with your family and you guys could support and help them get back to where they want to be in their life? So yeah, there's definitely, and about, different drugs having different effects, that's true. And if we could have effective prevention education in our school system so that people learn real prevention, that would also be wonderful. People could be informed about making those decisions for themselves.
And to follow up, and I love Dr. Carl Hart's work at Columbia University, and he wrote a book, recently called Drug Use for Grownups, and of course he pushes more so for legalization, but still he says that while some drugs, different drugs do have different psychoactive effects, individuals, including himself, who's a tenured professor at the Ivy League, does it because it makes him feel good. It helps him decompress. So like some of us drink alcohol, some of us drink wine. It's if you're able to do this, with the proper dosage, safely, without the stigma without the stigma associated with drug use, without the criminalization and having your life forever impacted, then decriminalization, at least for now, I think, in my opinion, is the proper way to go. Because as Dr. Carhart argues, individuals on Wall Street, professors at Ivy Leagues engage in this behavior. But again, conversations about drug legalization, decriminalization, the war on drugs more broadly, one of the main issues is this disproportionate impact on communities of color, and it's racist and it's inherent classism. So we focus on impoverished, struggling, disenfranchised users, not thinking about individuals who are working professionals who are highly successful that also use these drugs.
And the TCNJ library has that book. For anyone who wants to go read it.
Okay, so the next question, would rehabilitative decriminalization efforts include funding for school or for job training?
Oh, yes. It's not a yes or no, it's a yes. The plan, right now there's just a plan. There's a hope, there's an aspiration. So all of those things would be necessary. It would need to be a comprehensive program that provided support services. It needs to provide treatment, it needs to provide housing, job training, job support. In Portugal, what they did when they first launched this, not only did they give job training, but they paid half a person's salary for the first year doing apprenticeships in different careers so that people would bring them on for their first job after their training, because they only had to pay them half because the government paid the other half. And then they either continued on and paid their salary, or they had a year of working and a good reference to go out and seek another job. There are ways to support, retrain support, and really move this forward. And there would be resources for that. The amount of money we put into locking up people is astronomical.
I just want to make a personal point. Part of the reason that I'm on this panel is because I was raised by a father who was a high school teacher in the city of Philadelphia, and he would come home despairing that a lot of the people, some of his most talented students, were caught up in the criminal justice system, caught up in the drug trade, largely because of the lack of jobs and infrastructure in the community, and because of the ways in which drug use and drug trafficking was glamorized. And he said some of his most talented students. And I was raised by a woman who was a social worker who worked on elder abuse cases. And during the time of the crack epidemic, she was often the person who went with the police into hostage situations and to other emergency situations, and she was the person who was in charge of de-escalating those situations. And my father also had small business, worked for small businesses where in neighborhoods that were considered, there were open air drug markets, and had his life threatened more than once. And the first conversations I heard about decriminalization came from them, because they saw that what was happening and the way the government was approaching this was not working, wasn't working for anybody.
Everybody, all right, I have one more clarification question and then our final question. So this one's for Dr. Gibson. Just making sure this person's making sure they heard you right. So as it relates to the lack of a harm reduction infrastructure, is it safe to assume that having one would impact the school to prison pipeline? And might that be the reason for such difficulty in strengthening the infrastructure?
Absolutely. Absolutely it would. The difficulty in strengthening the infrastructure is it's not a priority. Empowering this population, decriminalizing drugs, removing them from prison, giving them rights, strengthening their communities, repairing the intergenerational trauma that's been created from this, is contrary to a lot of desired policy initiatives. It continues to be a racist policy today, and it's racist to continue to support it. And so, yes, it would absolutely make a difference.
And then our last question that we'll wrap up with is, how can we get a copy of this presentation after today?
The video is going to be made available. There's a website that it's going to be posted on. Let me see if I can. If I can find what it's called. Well, you know what? You'll get a copy of it if you sign up on the form that's there. That organization will show you how you can access the video. So the link to that form is in the chat.
You can also send out that website, Sandy, in the follow-up email to everybody.
There you go. I can do that.
Great. Any final thoughts from the panel as we wrap up for the night?
I just want to thank everyone for coming.
This was awesome.
And one thing that stuck with me, I think, Sandy, you mentioned in your presentation how we need to prioritize, put priority over humanity, rather than punishment.
Yes.
So if the audience can remember that,
that's a good thought to walk away with.
And I do think it's an idea whose time has come.
Mhm.
I don't feel like, this is a movement in the country and in New Jersey. I think there's an openness there wouldn't have been 10 years ago.
Mhm. All right. Thank you, everyone, for coming. Have a good
Thank you so much.
evening.
Have a wonderful evening.
Thank you.
Good evening.
Good evening, everyone.